One of the last actions of the outgoing U.S. Surgeon General was to warn Americans about the dangerous link between alcohol and cancer. His special advisory was designed to raise awareness about the connection and to help Americans understand the risk. Helping us to better understand the risk between alcohol and cancer is Dr. Ben Weston. Dr. Weston is the Milwaukee County Health Policy Advisor and an associate professor at the Medical College of Wisconsin's Department of Emergency Medicine. Thanks so much for being with us.
Good to be back with you.
Can we just start with the basics? How does alcohol consumption increase our cancer risk? Is there something that alcohol does to our bodies that raises the risk?
That's right. So what alcohol really does is it causes what we call oxidative stress. But what that means is it's actually damaging the cells within our body. Now, what that can do is it can lead to problems with the DNA in our cells, and that can lead to cancers. And so research has shown, and the public health community has known for a long time, that there's a clear link between alcohol use and cancer. In fact, 7 different types of cancer, including breast, liver, and colorectal, have been linked to alcohol use.
It was surprising to me to know that those particular cancers could be tied to alcohol risk. And it was really interesting to see that almost 16% of breast cancer cases can be tied back to alcohol consumption.
That's right. I mean, in fact, this is the third leading preventable cause of cancer nationwide after tobacco and obesity. It's responsible for contributing to 120,000 new cancer diagnoses each year in the United States. And just as you mentioned, a lot of folks aren't aware. In fact, 45% of US adults are not aware that consuming alcohol can increase your cancer risk. So that's one of the big points of what the Surgeon General is doing and of discussions like this, just to make folks aware that there is a linkage there.
So there is this linkage. What do we do? Does that mean that we have to stop drinking alcohol? We severely limit it? We look at moderation? Where does the problem begin with that link and kind of setting off that trigger between alcohol consumption and cancer?
Right. So the challenge here is that it is difficult to recommend a specific level of alcohol. Now, in the past, there's been things saying, 1 drink a day for women, 2 drinks a day for men. There's been definitions around binge drinking. There's been all these recommendations out there. But the fact of the matter is there doesn't seem to be a clear, safe level to recommend of alcohol. So what is the best recommendation? I think it's to try to cut down. However much you can cut down your alcohol use is probably going to benefit you, not just from a cancer standpoint, but from a liver standpoint, from a sleep standpoint, from all these different perspectives, overall health. There's a lot of empty calories in alcohol. And so if you are able to cut down your alcohol intake, you're probably going to see benefits from that.
That's a challenge for people here in Wisconsin. We know that Wisconsin tends to rate highly when it comes to states where there's binge drinking as an issue or a problem. People enjoy their beer or that brandy old fashioned. How do we begin to make that transition to understand that there are some very real consequences that maybe we didn't understand in the general public to excessive drinking?
That's exactly right. I think it gets to the question of how do we decrease use of our alcohol? And I think that's unique to every person. You may be somebody who has 1 drink a month when you go out to dinner to a restaurant. You probably don't need to worry too much about that. But if you're somebody who has a couple of drinks each night to wind down, that's something you want to look at. And that's something you want to try to cut down for. So you want to set yourself up for success. Know when you're more likely to drink alcohol and how can you cut down. Maybe it means you only drink alcohol when you go out, and so you stop keeping alcohol in the house. Maybe it means you try to switch at certain times to non-alcoholic drinks, whether it's one of these mocktails or if it's a non-alcoholic beer or a soda. Now, there's other health issues there too, but trying to decrease your alcohol in ways that are going to work best for you.
One of the things this outgoing Surgeon General suggested was that there needs to be a warning label on products that contain alcohol, just as the warning label that's on there now that warns about drinking alcohol when you're pregnant and making sure that you're not drinking alcohol if you're going to be driving or operating heavy machinery. Is that a viable option?
I think it's an interesting option to discuss. When you think about the facts, number one, the fact that 45% of US adults don't know about this. So you do somehow need to get more messaging out there. The fact that it's 120,000 cancer diagnoses a year that are contributed to by alcohol, and the fact that it's the third leading preventable cause. I think when you take each of those and you consider that, some sort of messaging campaign to make people more aware so that they can make their own decisions of what is going to be healthiest for them. Is it a label? Is it a messaging campaign? I think it's hard to say, but certainly talking more about it, researching that, and understanding what's going to be the most effective way to message this is going to be really important.
How important is it that people are honest with their physicians too? When you go in for that annual checkup and they ask you, how many cocktails or how many drinks do you have, alcoholic drinks do you have every week? It's important to be honest about that.
It is important to be honest about that. I'll tell you, as a physician in the emergency department, I ask that question all the time to my patients, and it is helpful to be honest. I don't think most physicians judge their patients based on the answer, but they certainly come up with a plan of how to promote your health, how to prevent future disease based on that answer. And so, if somebody tells me they drink once or twice a month, probably not going to have much intervention. If somebody tells me they drink 3 to 4 drinks a night, we're probably going to start talking about, what that alcohol use means for them, what it could mean for their health, and what might be some strategies to cut down. But you have to remember, in the end, your physician, your nurse practitioner, your healthcare provider, whoever it is going to advise you. But it's up to you on how you're going to modify your day-to-day behavior to maximize your health and also feel as good as you can on a day-to-day basis.
It is such important information, Dr. Weston, that far too many of us are just not aware of. So we thank you so much for being here with us and for sharing this information and giving us all something to think about.
Of course. Thanks for having me. We'll talk to you again soon.
Thanks, Dr. Weston. And thank you all for being with us. We'll be back next week for another Connect MKE.